Hi, I want to address a post I recently saw on Facebook about a 14-year-old child who went to a children's hospital with a broken clavicle. According to the poster, Motrin was controlling his pain at the hospital. The parent refused an injection for pain, and the child was later sent home with what the writer called Oxycontin. The post then used that story to warn the public about opioid addiction. And this is exactly the kind of misinformation that continues to harm legitimate patients. First, we do not even know whether the medication was actually Oxycontin or immediate release oxycodone. Those are not the same medication, and the poster was not the parent. Oxycontin is an extended release medication, and its lowest tablet strength is 10 milligrams. People often incorrectly call every oxycodone prescription Oxycontin, even when that is not what was prescribed. Before publicly accusing a children's hospital or a physician of reckless prescribing, the actual medication, doses, instructions, and quantity should be verified. Second, this child had a broken clavicle. That is a painful traumatic injury. Motrin may have been controlling his pain at that particular moment, but that does not mean it would not continue controlling the pain after the medication wore off. The swelling increased, the adrenaline subsided, the child started moving around, or he tried to go to sleep. The physician may simply have been compassionate enough to give the parent another treatment option in case the child's pain became severe later. And let's be clear, a prescription is an option. It is not a command to take every pill. The parent did not have to fill it. The parent did not have to give it while the Motrin was still working. It could have been used only if the child developed severe breakthrough pain, or it may have never been used at all. Facts we do not know. Texas law also limits opioid prescription for acute pain. For an injury like this, the prescription could not exceed a 10-day supply, and it could not include refills. Oxycodone is also a Schedule II medication, meaning it legally cannot be refilled. This child was not sent home with an endless supply of medication. He was given a legally limited treatment option for a documented painful injury. Being prescribed opioid medication for a legitimate medical reason does not equal addiction. A patient receiving medication for a broken bone is receiving medical treatment. A cancer patient receiving pain medication is receiving medical treatment. A surgical patient receiving pain medication is receiving medical treatment. And a chronic pain patient receiving medication to function is receiving medical treatment. Physical dependence is not addiction. Tolerance is not addiction. Needing medication to control a serious medical condition is not addiction. Diabetics are not addicted to insulin. Patients with hypertension are not addicted to blood pressure medication. Patients with heart disease are not addicted to heart medication. And pain patients should not be labeled addicts simply because their treatment includes an opioid. This is why I'm done using the phrase opioid crisis, the way the media, politicians, and even some advocacy groups continue to use it. That phrase has blurred together two completely different problems. So, from now on, I believe we need to call these crises what they really are. The first is the street drug crisis, where the real threat is illicit fentanyl and counterfeit drugs. That crisis involves illegally manufactured fentanyl, counterfeit pills, heroin, contaminated street drugs, criminal trafficking, and substances being sold without any medical oversight. That is not the same thing as a physician prescribing a limited amount of pain medication for a legitimate injury or illness. The second is the real opioid crisis, legitimate pain patients being denied treatment and losing their lives. That is the crisis the public rarely hears about. Legitimate opioid prescribing has already been drastically reduced. Patients now face prescription monitoring, databases, drug testing, medication agreements, pill counts, frequent appointments, pharmacy refusals, insurance restrictions, dosage limits, and constant government scrutiny. Doctors are afraid. They are afraid of investigations by the DEA. They are afraid of losing their licenses. They are afraid of losing their DEA registrations. They are afraid of raids, prosecution, and having their entire medical practice destroyed. And that fear affects patient care. Doctors stop accepting pain patients. Stable patients are forcibly tapered. Patients are abruptly discontinued from their medications. Pharmacies refuse legitimate prescriptions. Hospitals undertreat severe pain. And some patients are told to survive on Tylenol or other treatments that are completely inadequate for the severity of their conditions. The 2016 CDC prescribing guidelines contributed to this environment. Although the CDC replaced it in 2022 and acknowledged that the earlier recommendations had been misapplied, the damage was not automatically undone. Hospitals, insurance companies, pharmacies, medical practices, and government agencies had already created rigid policy bases on those earlier numbers. Many of those policies are still being used today. And the general public may not understand this because it has not affected them personally yet. But pain can happen to anyone. A car accident can change your life overnight. Cancer can change your life overnight. A major surgery, spinal injury, nerve disorder, traumatic fall, or incurable illness can change your life overnight. And when that day comes, you may discover that the medication capable of helping you is no longer available, not because it would be medically inappropriate, but because doctors are afraid to prescribe it. For many chronic pain patients, medication is not about getting high. It allows them to get out of bed. It allows them to work. It allows them to cook, clean, care for their families, attend appointments, sleep, walk, leave their homes, and maintain some level of independence and dignity. Some patients have no cure. Some have exhausted physical therapy, injections, surgeries, procedures, and non-opioid medication. Their pain does not disappear simply because society has been taught to fear the treatment that helps them function. I am the founder and executive director of P.A.R.T Texas and P.A.R.T USA, which stands for Pain Awareness, Right to Treatment. I have also lived as a chronic pain patient for approximately 30 years. Our organizations would not need to exist if millions of patients were not being undertreated, stigmatized, abandoned, and denied appropriate medical care. And the spread of misinformation, like the original post, is not harmless. It frightens doctors away from treating pain. It encourages hospitals and medical practices to create policies that are even more restrictive than the law is. It pressures lawmakers to interfere with individualized medical decisions, and it causes patients to lose access to treatment that may allow them to function and live. When someone is forced to live every hour of every day in severe pain, uncontrolled pain, with no cure, no adequate treatment, and no hope anyone will help, some eventually decide they cannot continue to living that way. That is the reality people ignore when they spread fear and misinformation about legitimate pain treatment. This information is costing people their lives. It is costing them their independence. It is costing them their livelihoods. It is costing them time with their families. It is costing them hope. And in some cases, it isn't costing them their entire lives. So let's stop calling this the opioid crisis as though legitimate doctors and pain patients are the ones creating the dangers. Call it what it is, the street drug crisis, where the real threat is again illicit fentanyl and counterfeit drugs. And recognize the crisis happening inside our healthcare system. The real opioid crisis, legitimate pain patients being denied treatment and losing their lives. These are two different crises, and confusing them both is killing people on both sides. People using illicit drugs are dying because of fentanyl, counterfeit pills, and contaminated street drugs are flooding our communities. Legitimate pain patients are suffering and dying because they fear misinformation and failed policy are taking medically necessary treatment away from them. Blaming doctors who responsibly treat pain will not stop drug cartels. Restricting legitimate prescriptions will not remove counterfeit pills from the street. Forcing stable patients off medication will not stop illicit fentanyl. Leaving people bedridden, unable to work, unable to care for themselves, and unable to escape relentless pain is not public safety. It is cruelty disguised as policy. And every person who spreads this false narrative needs to understand something. Your words have consequences. When you accuse a physician of wrongdoing simply for treating pain, you add to the fear that causes another doctor to stop prescribing. When you claim that a legitimate treatment creates addiction, you help justify another forced taper. When you confuse pain patients with street drug users, you help create another hospital policy that denies adequate relief. And when a patient can no longer endure the untreated pain of isolation, the loss of function, and the loss of hope, that misinformation is no longer just an opinion. It has become part of what costs that patient their life. You may believe this issue does not affect you. You may believe you will never need opioid pain medication. You may believe Tylenol or Motrin will always be enough. But pain does not ask permission before it enters your life. It can come through a car accident. It can come through cancer. It can come through surgery, infection, nerve damage, spinal disease, traumatic injury, or an incurable condition. And when it happens, you may discover that the treatment you once helped condemn is the very treatment you desperately now need. You may discover that the doctor wants to help you, but is now too afraid. You may discover that the hospital has a policy against adequate pain treatment. You may discover that the pharmacy refuses the prescription because they are also afraid to prescribe. You may discover that the government has interfered so deeply in medical care that your physician's judgment no longer matters. And on that day, you may finally understand what chronic pain patients have been trying to tell this country for years. But by then, it may be too late. So stop repeating the false narrative. Stop placing the blame on legitimate patients and responsible physicians. Stop pretending that denying pain treatment is saving lives when patients are losing their health, their independence, their livelihoods, and their families, their hopes, and sometimes their lives. Put the blame where it belongs. The real threat on the street is illicit fentanyl and counterfeit drugs. The real crisis inside medicine is patients being denied treatment. And until this country learns the difference, people will continue to die while policymakers congratulate themselves for solving the wrong problem. And that person just might be a loved one or you. If you would like more information, please visit PARTtexas.com or PARTusa.org. Pain is not a crime. Hi, thank you for watching this very important message. I hope you now better understand the difference between street drug crisis and the real opioid crisis affecting legitimate pain patients. My name is Ingrid Kitty Trim, founder and executive director of P.A.R.T Texas and P.A.R.T USA. Through our work, we have already helped bring important changes and greater awareness in Texas, and we are continuing that work across the country. Our goal is to make sure pain patients receive appropriate individualized care while also protecting patient safety. We believe this can be done lawfully, responsibly, and with the proper medical oversight. Patients should not be abandoned or denied treatment, and doctors should not be afraid to provide medically appropriate care. There is a responsible path forward that protects both access and safety. If you support our mission or would like to know more information, please visit us at PARTtexas.com or email us at info@PARTtexas.com. We are here to answer your questions, provide information, and help people better understand the importance of pain awareness and the right to treatment. Thank you again for watching, listening, and helping us change this harmful narrative.